All right, so I have the privilege of being involved in the fellowship program, which is really one of the crown jewels of IPC, and where we get our new membership from as well. I want to thank Elise Klein, who's also on our fellowship committee, and as well as, forgive me for mispronunciations, Priscilla Anguineni from Kenya, Claudia Contreras from Paraguay, Christina Echeverria from Argentina, Dimitrios Ioannidis from Greece, Wilson Liao from the United States, Mohammed Mawa from Bangladesh, and Andrew Pink from the committee, who are all involved in this. So thank you for everyone who helps select the fellows. And of course, I need to acknowledge Peter, Nikora, and Maureen from IPC staff who do an amazing job behind the scenes. So what we're going to do is roughly 5-minute presentations from each of the fellows and the work they've been doing. I want to introduce Julia Cura. Is Julia here? Excellent. Okay, welcome to the podium from the Hospital Italiano, Buenos Aires, Argentina. And she's a co-leader of a psoriasis team at the Department of Dermatology in Argentina, and she studied with IPC counselor Diamond Thatchy at the University of Lübeck in Germany. Welcome.
Thank you for the presentation. It's a pleasure for me to stay with you. And while I have prepared some words, but in fact, I be more comfortable if I speak by myself. Well, I am from Argentina. I think that my country is globally known because of them, that they are Messi and Maradona. Yes, I was born in Olavarría, that it's a city located at least at 350 kilometers from Buenos Aires. That's my family. They are my big support for all of my decisions. And that's why I keep this photo with me. And, well, I am the second of 4 siblings. Well, I moved from Olavarría to Buenos Aires to study medicine. I became then a dermatologist. I started work in Hospital Italiano from Buenos Aires, that is recognized as the most important university hospital of Argentina. And since 2 years ago, I make a decision to share with my town my work. So I work most of my time in Buenos Aires in a high complexity center, and I move to my town 1 week per month to do my job there. My interest in psoriasis starts in the last year of my residency. And since then, I be part of the psoriasis team. Thanks to teamwork, I would be able to publish some of research. That's why I know that I need to deepen my knowledge in clinical research, so I started a master in clinical research. Fortunately, this year I am going to share my preliminary results in the psoriasis from germ to clinic in the next days. And this year I have the opportunity to be one of the fellows of the IPC program that, personally speaking, it's an unforgettable experience for me. I spent the time of my own site observation in Germany, Lübeck. Dr. Thatchy was my mentor, and also along with David and Christian, I experienced how to do clinical research trials and things that are not so easy to do in Argentina. After then, I went to the ADV in Amsterdam. I present a poster related in virtual communities for psoriasis patients. And speaking about the classes and the co-mentoring, I would like to highlight the time that all the professors spent with us. I learned a lot, and I am grateful because of that. And now we are making the first steps in working together in transcriptomics with Dr. Thatchy and all my fellow partners. And for the future, I want to continue to be part of the activities of the IPC, especially IPC LATAM, so I hope we could do all together. Thank you very much.
All right, I'm going to get my steps in coming up and down the podium here. That was very nice, Julia, thank you. Next up is Dr. Ashar Dhana from the Groot Schuur Academic Hospital in Cape Town, South Africa. Dr. Dhana is a consultant dermatologist in the Division of Dermatology in Cape Town, and he currently is studying with IPC counselor Andrew Pink at St. John's Institute, right down the street. Is he here? No? Maybe a little bit late, okay. All right, we will hopefully come back to him. Next up is Bryan Guevara. Is Bryan here? Oh, it's you. Okay, okay. Okay. It's a quick hook in the IPC. We're going to keep things on time here. Okay. Welcome.
Sure, thanks. Sorry, I thought you were looking for Andrew. Okay, good day, everyone. It's great to be here at this think tank and the conclusion of this year-long IPC fellowship journey. My name is Ashar, Dhana, and I'm a dermatologist and senior lecturer in Cape Town, South Africa, working at Groote Hospital. Perhaps this is best known as the site of the world's first human heart transplant. I'm in the early stages of my career, having recently completed my dermatology training, and one of my key focus areas is in managing severe inflammatory skin diseases, with a particular interest in psoriasis, a condition that significantly impacts the patients that we see on a daily basis. At our institution, we have an 18-bed dedicated dermatology inpatient ward, and I would say psoriasis accounts for about 25% of those admissions and a lot of the outpatients that we actually see. For this reason, I was keen to deepen my expertise and seek innovative ways to improve patient outcomes for these patients. This fellowship has been a great step towards achieving that goal. So over the past year, this fellowship has been an incredible opportunity for growth and learning. We've had multiple fellows classes on different psoriasis topics, and a standout feature was the co-mentoring sessions. We had the privilege to engage with experts in psoriasis on a one-on-one basis often. These sessions enriched both my theoretical understanding and practical skills in areas that I felt were lacking. For instance, with Dr. Najib Dos, who is from Tunis, we delved into the nuances of nail psoriasis, learning advanced diagnostic and management strategies, and even the art of nail photography. These skills will help me address this often overlooked aspect of psoriasis that we tend to see in our setting. With Dr. Kaub in Buffalo, we tend to look at biologic therapies, and his expertise clarified how to use these agents in managing complex cases. This session was particularly relevant as a colleague and I have recently started a public sector dermatology biologics monitoring clinic. Dr. Evans in Austin expanded my perspective on patient advocacy and biosimilars, and in a second session, he generously also shared his insights on phototherapy. We covered practicalities such as establishing and operating a successful phototherapy clinic and developing tailored treatment protocols, which he even shared with me after. I'm now 3 days into my 2-week observational period with the privilege of observing at Guy's and St. Thomas's Hospital under the mentorship of Dr. Andrew Pink. During this time, I aim to gain hands-on experience in advanced psoriasis management and understand how to deliver high quality and safe care. Dr. Pink has also been kind enough to arrange several rotations in non-psoriasis specialty clinics to ensure that my timetable is quite full. My hope is to adapt the insights I gain to my local context, improving psoriasis and dermatological care at my hospital. So looking ahead, this fellowship is a springboard for several ambitions. First, I plan to establish a dedicated psoriasis care program at my institution. The program will focus on early detection of comorbidities, multidisciplinary management, and patient and trainee education. Leveraging the insights that I've gained during this fellowship, I aim to expand and improve the services that we provide, especially our biologics monitoring clinic. Second, I intend to contribute to impactful research. Specifically, I aim to explore the applicability of individual participant data meta-analysis, tools that I studied during my MPH and my PhD in enhancing psoriasis care, especially in resource-limited settings. Lastly, I hope to become a mentor myself, using the knowledge and skills that I've gained during this fellowship. In closing, this fellowship has been a fantastic experience, enriching my professional abilities. I'd like to express my thanks and gratitude to my mentor, Dr. Pink, and my co-mentors, the IPC, and importantly, the dedicated staff that run this program for creating such a great program. And thank you all for your attention.
All right, that was really great, Ashar. Thank you for that. Next up is Bryan Guevara from the Southern Philippines Medical Center, Davao City, Philippines. Dr. Guevara is a board-certified dermatologist and a dermatopathologist, unique in our group here, so thank you for that. In Southern Philippines Medical Center and Southeast Dermatology, he's currently studying with IPC counselors Chris Griffiths and Darren Ashcroft at University of Manchester. Welcome.
Hello, everyone. Thank you so much for this opportunity. IPC, thank you. So on behalf of fellows for this year, so we would like to thank everyone, especially the counselors and also our mentors, for being so great in terms of providing their special and unique skills and time to us. So thank you for that. So basically, I'm a dermatologist and dermatopathologist, so I work with a PDS. So PDS is a Philippine Dermatological Society. I'm into research and also for examination for the residents back home. So yeah, that's our location down south, so Philippines, southern Philippines, basically in Davao. So it's one of the largest cities in the world in terms of landmass. So we consider ourselves, Dr. Aguiliano and I consider ourselves a psoriasis advocates. So we have Psoriasis Philippines and also Psoriasis Foundation in the Philippines. So we do yearly or monthly meetings with our psoriasis patients, and hopefully we can provide them their best care in the Philippines. So yes, I have been a fellow for the year, and also I've been have the great opportunity to be the ILDS awardee as well. So for the activities, we had 1 year of monthly sessions with Professor Griffiths and Professor Darren. So we had also a really good discussion in terms of developing studies, such as in terms of focusing on the quality of life, especially in the Philippines, where there are limited data in the low and middle income countries, such as the Philippines. So we had also several meetings face-to-face, previously in the AAD in San Diego, and also we were able to complete the data collection for our study. So I had the privilege also a few weeks ago, I visited the University of Manchester with a GPA team, Global Psoriasis Atlas. I've also had the opportunity to study and learn Bad Beer, their registry with Danielle and also the PhD students. ILDS also had a visit in the GPA team, and I think that was really amazing, especially that we're developing different studies all over the world and focusing also on the quality of life in the Philippines. Also, there were different opportunities given to me through IPC, of course, with ASP. Dr. Joe here is from South Korea. So we had also a really good meeting in discussing different psoriasis landscape across Asia, particularly in our region. Also in Kuala Lumpur, Dr. Chun and also Azura here, where we're having also our probably quarterly meetings, and hopefully that will be really nice also with the event of IPC Masterclass in Asia. Of course, new friendship in UK, of course, East meets West. We had the privilege also of learning the history of London and also UK through my VIP tour guide, Professor Chris. And of course, Professor Darren, thank you so much for your time. And also, it was really fun with all the consultants we have here also in Manchester and also in London. So, yeah. So future directions, hopefully we get to publish and present our data. So those are the 3 Ps: publication, partnership, and probably IPC in the Philippines. In fact, I made already a preview, hopefully in the Philippines, IPC in the Philippines in the future. Was that smart? Yeah. So maraming salamat. So thank you so much. Thank you.
Well, it's very generous for you to host us at your home in the Philippines. We're looking forward to stopping by. That was great. Next up, and forgive me if I'm mispronouncing anything wrong, Jan Hugo, am I right? Jan? That's right, yeah. From the University Hospital Kralovsky. He says exactly right. It's perfect. All right. In Prague, in Prague, the Czech Republic. Dr. Jan Hugo is the head of the outpatient unit in the Department of Dermatovenerology at University Hospital that I previously mentioned perfectly. He studied with IPC counselor Joe Lambert at Ghent University Hospital in Ghent, Belgium. Welcome, Jan.
So thank you very much for nice introduction with perfect accent. I'm really grateful that I received this fellowship, and I'm really happy that I have possibility to present you today my experience with that. But first of all, let me introduce a little bit of myself. So I come from Czech Republic. I know that I will disappoint some of you, but yes, from the most beautiful city in the world, from Prague. So I work mainly in the university hospital. Currently, I'm responsible for everything which is outpatient, so my head is every day under the guillotine if something happens. But last year I was persuaded to work 1 day a week as a consultant for special institution, special hospital that is focusing on transplantation, and you can imagine that these patients always have something on the skin, so that's my new responsibility. So the first part of the fellowship were the fellow classes. We discussed so many hot topics, so I can talk till tomorrow, but these are my personal highlights. Thanks to Professor Blauwelt, I fall in love with this term high impact sites, because before that I struggled with the terms like difficult to treat location, special areas, but this term, it's really what it is. Then with Professor Gisondi, we discussed if we can prevent some comorbidities, for example, PSA, and based on these talks, I got idea about one project in Czech Republic. I will talk a little bit more in a few moments. Thanks to Margot Keeney, I was able to find out that although in Czech Republic we have a lot of restrictions prescribing drugs from other specialties, that I can use escitalopram. I already started to use that, and it really works. The patients are happy. I'm just a little bit worried that someday I will call it a dealer, as they are so happy with it. And with Professor Tachi, we discussed the heterogeneity of the pustular psoriasis, especially the PPP. And as Julia already mentioned, we got even like idea about one small fellow study. Julia is right now awaiting the results from the lab, is it really feasible to do that. Another thing that the fellowship allowed me was to visit the IFPA conference, as it was Congress focused on psoriasis. It was extremely valuable for me. So there were so many interesting topics, talks. For example, Professor Prince discussed the autoimmune nature of psoriasis in some patients, and Professor Goodyear had the really interesting talk about if we are aware that it might be that we can affect the trajectory of the disease with some drugs, so we can affect another drugs that in the consequence. And the last part of the fellowship was the on-site visit at the department of your mentor. My mentor was Professor Lambert from Ghent, so I experienced a really delightful month with her and her psoriasis team. I put the left picture not only to show you that they moved recently to the high-tech building, but you can see early morning and just 2 floors already working. Guess which department? Yes, dermatology. So during this month I can see everyday management of the scientific projects, but I also could see like really great management of things like if you want to standardize taking photos, yeah, easy, put black paint on your wall. Great. And for example, I also see for the first time this analog injectable pen to inject the corticosteroids if you want to treat the nails. Great. And as a bonus was the location, like the Flanders here with the beautiful cities of Ghent, Bruges, Antwerp, so great experience. And the last part, yeah, my future hopes, future plans. So I hope that I can continue to work for IPC in many levels, like helping to do some presentations, to help with the core projects. But, and with this work to become a full counselor one day. I hope also that a part of this, that I can build some international collaborations. So if anyone will want to do it more internationally, to share some data with Czech guys, I will be really happy to participate. I also hope that I can increase the national projects. Philip Ropp, recent new counselor, my friend, just this year, he organized several young dermatologists, and we dig our files to to get some data regarding like biologics and the outcomes in elderly patients, and we are waiting for publication. With Philip, we have 2 ongoing projects on microbiome. And unfortunately, our hospital, it's crazy, we don't have rheumatology department, but I made a collaboration with one rising star rheumatologist from another hospital, and just this year we applied for a big grant from Ministry of Health. And if we will receive the funding for this, it will be probably also because of IPC, because there is a new evaluation of these projects, and one part that you get points are if you are collaborating, if you're part of some organization. And of course, there are some other plans, possible plans, that last year I finished my thesis, and I hope that next year, maybe the next year, I could become a tutor for my own PhD students. And as I mentioned before, our biologic registry, unfortunately, it's owned by third party. So every time you want some data, you have to pay for that. But as I became the fellow, 3 companies, it's not 100%, but they promised some funding of these analyses. And hopefully, yeah, our boss have some tax issues, so the companies just withdraw with clinical trials, but with the new professor, Galpakiotis, I hope that the companies will come back again, so we will, that I can also participate in this part. So with this, I want to thank you for everything, and I will be really happy to collaborate, and please come to Prague.
Very nice. It is a beautiful city. Okay, next up is Shekhar Neema from Base Hospital, Lucknow, India. Dr. Shekhar Neema is an associate professor of dermatology at Base Hospital, an affiliate of King George Medical University in Lucknow, India. He studied with IPC counselor Elise Klein at the University of Manchester, United Kingdom. Come on up.
Good afternoon, everybody. Thank you, Dr. Joel, for introduction. So I come from India, and this is a famous monument in India called in Lucknow called as Rumi Darwaja, and this is where I'm from. This is Uttar Pradesh, and the capital city of Uttar Pradesh is Lucknow. And this is obviously, it's very close to Taj Mahal. It's my family. And this is my college where I studied, Armed Forces Medical College. This is located in Pune, and from there now I have shifted and I'm working in Lucknow. So my mentor was Dr. Elise, and I did 2 weeks tenure with her from 1st of May to 15th of May and in Salford Royal NHS Hospital. There I met the Global Psoriasis Atlas team. I also attended psoriasis clinic there. Also did multidisciplinary meeting, psoriasis meeting, which was very, very interesting. Then I attended the counseling session prior to biologic initiation. I mean, that was a very, very detailed counseling session they do. It's almost lasts for about 30 to 45 minutes. Then I saw the referral system. I went to the primary care center in UK and saw how the primary care system works here. I visited basic science lab at university, visited outpatient department, trichology and other subspecialties clinic. And I also got the opportunity to talk to residents there, and I took a class for them on leprosy, which is extremely uncommon here, but we see a lot of leprosy cases in our country. So Professor Elise also invited me for dinner at her house, and I'm very grateful for her hospitality. So the key learnings, so I understood the global perspective of psoriasis by being a part of this IPC fellowship in the last 1 year. I mean, it was my 5th attempt and last attempt to apply for fellowship. Fortunately, I got it this year. So we discussed a lot of topics in co-mentoring group like nail psoriasis, phototherapy, comorbidities, quality of life. This is something that we don't discuss. And because of this, I started a project on intermittent fasting in psoriasis, and that was a phase 2B clinical trial that we finished and published, intermittent fasting in psoriasis. I also did another, from our group, we also published cardiovascular comorbidities in patients who are on methotrexate. We also did a lot of studies on latent tuberculosis in patients we are planning to start them on biologics. And I had an excellent mentorship throughout the year. We kept on learning throughout the year. And the future plan is we want to continue working on various aspects of psoriasis. So patient support group is something that we see everywhere, especially here. I saw a beautiful patient support group in Manchester, but that is something that is lacking in our country. We don't have any patient support group. So there is no patient advocacy, I mean, the insurance do not pay for skin disease treatment. So all the skin diseases treatment is out-of-pocket expenses for our patients. So I mean, unless you have advocacy from the patients, the government and the insurance companies are not going to relent to this demand of ours. So the plan is to start a patient support group, motivate our patient to start patient support groups. And I like to be continue to be part of IPC activities and continue learning about psoriasis. So thanks to Professor Peter, Professor Harvey, and Dr. Joel for giving me the opportunity, Maureen and Nicora for support during the entire year, to my co-mentors and to mentors and my fellows, and special thanks to Professor Elise and her husband, Dr. Rajkumar, who kindly took me around and showed me the entire primary care setup in UK. Thank you.
Thank you, Dr. Neema. That was really fantastic, and we really appreciate your persistence and reapplying, and that means a lot to us as an organization. And we know you can do a lot of great things in India. It's really part of extending what the IPC is trying to do with psoriasis globally. Next up is Josep Riera Monroig. Pretty close? Exactly right. I got 100% right. From Hospital Clinic de Barcelona in Barcelona, Spain. He's a consultant dermatologist at the Hospital de Barcelona, Spain, and a lecturer at the Faculty of Medicine, University of Barcelona. He studied with IPC counselor Wilson Liao at the University of California, San Francisco. Welcome.
Thank you, Dr. Gelfand, for that excellent pronunciation. Well, good afternoon, everyone. It's an absolute pleasure to be here. So, as he said, I'm currently working at Hospital Clinic de Barcelona, which is not the same as Professor Puig, because everyone in the psoriasis world asked me, "Are you with Dr. Puig?" And I said, "Unfortunately, not." So, well, I'm from Mallorca in Balearic Islands, but I moved to Barcelona when I was 18 to study in med school. And well, I did my residency also in University of Barcelona, and I finished my residency there 4 years ago, and I'm still working there, so lifelong experience in the same hospital. This year I'm finishing my PhD. It's on Mpox infection. So what I do day to day in my daily life in the clinic. So I'm leading the psoriasis clinic unit. I started leading the clinic 3 years ago when my mentor retired. I see patients with psoriasis 2 to 3 days a week, but I also see patients with other diseases like genodermatosis. We are a reference center for ichthyosis and epidermolysis bullosa, and also I take part in the sexual health program, so I do quite a lot of things. So my research areas are, first of all, the triggers of psoriasis, because we understand, for example, the infections in guttate psoriasis, but there are other triggers such as pollution or other environmental factors that we don't know of, or the psychological stressors that cause it. How deep has to be in a stressor to trigger psoriasis in a patient that is genetically predisposed? Secondly, inflammatory biomarkers, which is something that I think most of us want to know more about, especially those who can help us to understand which patients may develop PSA or not. And third, treatment gaps. We have really effective therapies, but there are some forms of psoriasis, such as palmoplantar pustulosis, that we don't really have like those levels of excellence. So, as you saw, I've spent 15 years in the same university, and I'm leading the clinic, but I'm pretty young, so I needed someone to mentor. So that's why I applied for this mentorship. I spent almost a month with Dr. Wilson Liao at UCSF, and apart from that, we did like monthly mentorship meetings. So I spent 2 to 3 days a week in his clinic, and 2 to 3 days a week in the research lab, mainly in the meetings and learning more about spatial transcriptomics, which I think is a technique we can learn a lot of, but it's pretty hard to interpret. And for example, there are some tiny things that, such as the methodology used might change the results, or the day you do this technique, you perform the study, you might have different results from day to day. So this is something that we still need to learn, and we need to know more about bioinformatics. This year, we participated with Dr. Liao in a review on artificial intelligence and psoriasis, and we're about to finish a systematic review on pollution and other environmental factors in psoriasis. And according to my research interest, looking for some biomarkers, we had a look at the role of calprotectin as an inflammatory biomarker in serum and in feces, and also with spatial transcriptomic. We'll see if it brings us some good results or not. During my mentorship, I also participated in the National Psoriasis Foundation meeting for residents and rheumatology fellows, and Dr. Liao invited me to be a speaker, which was also another big opportunity to present, like, in this big group in the States, coming from a smaller city. So, as you've seen, I think I have enhanced my research skills, and a very important thing that the IPC wants from the fellows, the networking, the understanding with the master classes. We've met key opinion leaders, and we've known the insights of their understanding of the psoriasis from their point of view. Thirdly, I also gain insight in the diverse way to treat psoriasis, because it's not the same in the States with these different health system than in Spain, that we still have to start with two classic systemic therapies, and of course advance the understanding of current research. Looking ahead, I think that's something that all my fellows have said, just foster this collaboration between institutions, between us. All together we can work and walk further. Strengthen the expertise in these new technologies that can answer our questions, and if we answer these questions, we can produce high-quality publications. And finally, I'd like to thank all the IPC members and the committee for selecting all of us to be a fellow. I'd like to thank Peter, I'd like to thank Nicora and Maureen for all their help. I'm sure they're kind of fed up with our emails, because we're saying, okay, please, can we change this or that? And well, I'm grateful to be here. Thank you, everyone.
And I think an IPC in Barcelona sounds like a good location as well. It's one of my favorite cities in the world. All right, near and dear to me is Huidi Shucheng, Dr. Huidi Shucheng from West China Hospital, Sichuan University, Chengdu, China, who is an attending dermatologist, Department of Dermatology and Venereology, West China Hospital, Sichuan University. He studied with me at Penn, and I hope you're not going to show all the photographs. Welcome.
Yeah, good afternoon. Thank you very much for your kind introduction, Joe. My name is Huidi Shucheng, Huidi from Huidi and the Blowfish. No, just kidding. And it's actually my honor and pleasure to present my journey this year in the fellowship, in the IPC fellowship. And I'm based at West China Hospital, Sichuan University, which is recognized as one of the leading research hospital here in China. And I should have included a photo for giant pandas, because that's what the city is famous for. And I'm in early stages of my career as clinical dermatologist, researcher, and lecturer. And my key interests includes the novel therapeutics and clinical and translational research, application of AI in dermatological science, and patient education and advocacy. And these passions, I would like to say, that's what actually drive my commitment to advancing both clinical practice and research in dermatology, particularly in psoriasis care. And for fellowship activities and highlights. So during my IPC fellowship, I had the privilege of working closely with leading experts and my fellows, other fellows, which has truly enriched my experience. And for my onset observation, as Joe mentioned, I had the honor of working with him at the University of Pennsylvania, and this comprehensive experience included clinical shadowing, project observations, especially the LIGHT project and the C3P project, and exposure to both clinical dermatology, epidemiology, and the skin of color considerations. And I didn't really show all the photos, so you're good. And I gained valuable insights from regular clinic as well as the PSA clinics, and attended the SID meeting. And through these activities, I witnessed the diverse treatment approaches as well as the psoriasis management vary from different healthcare systems. And I would like to point out that our co-mentoring groups were another highlight in this fellowship, where I collaborated on key topics with global experts in disease modification with Dr. Chisandi, nail psoriasis with Dr. Doss, as well as biologics with Dr. Kelp. And these collaborations allowed us to share challenges and tricky cases, as well as strategies from different environments. And this co-mentoring groups would be a great way to build a global network of colleagues I would continue to connect with throughout my career. And the key takeaway from this year, I would like to say, is the importance of multidisciplinary and evidence approach to psoriasis care. And this experience has deepened my understanding of how this clinical practice as well as research and the international collaboration can significantly improve patient outcomes. And for future goals, looking ahead, I'm determined to continue to contribute to psoriasis care through advancing our understanding by investigating the risk factors, biomarkers, and novel therapeutics to improve treatment outcomes. And for patient care, I would like to continue to contribute to enhancing patient outcomes with personalized, evidence-based treatment strategies, and integrating AI and other digital tools for better diagnostics as well as care delivery. And I will looking forward to actively contributing to international psoriasis initiatives as well as educational programs and strengthening global partnerships to push boundaries of dermatological science. And with that, I'm deeply grateful for the opportunities and insights gained throughout the IPC Fellowship, and thank you to IPC and for this exceptional experience, and to all my mentors, as well as all of you here today for your collaboration. I'm looking forward to learning more from you during this think tank event and continue to our shared mission of improving psoriasis care through network, innovation, and collaboration. With that, thank you.
Thank you, Huidi. I'm looking forward to working with you more in the future. That was really nice. I'm still waiting for the panda to arrive, though. I think you guys sent us a panda. We're still waiting for that. All right, so last but certainly not least is Alison Treichel, who's at University Hospital's Cleveland Medical Center, where she's a senior resident in the 2+2 program, research track, under the mentorship of IPC counselor Dr. Kevin Cooper, where for her dermatology residency. As an IPC fellow, she's under the mentorship of IPC counselor Alvaro Gonzalez Quintero, who is my former fellow way back when he was a fellow in this program. So I feel like a grandfather now, a grand mentee. So this is a big honor for me. Please welcome to the podium, Alison.
Thank you for the introduction, and good afternoon, everyone. I'd like to thank the IPC for this wonderful opportunity to participate in this fellowship. I had an absolutely wonderful time. So I grew up in Saratoga Springs, New York, which is 3 hours north of New York City, and it's a small city. I then went to Buffalo, New York, which is one of the snowiest cities in the country. My first winter there, we got 7 feet of snow in 2 days, so that was fun. During medical school, I spent 2 years at the National Institute of Health doing research on tuberous sclerosis. That's where I caught the research bug. Now I'm at University Hospitals in Cleveland in the 2+2 track, which adds a bonus year of research and protected time for that. And I'm with Dr. Kevin Cooper, our chair, doing that, and we'll be graduating this June. And here's a picture of Cleveland. It's a very underrated city. It's got a nice waterfront on Lake Erie. We do have a beach as well, so definitely check it out if you're in the area. So this year was very productive. I started off the year giving birth to my daughter Vera in January. So she's almost 11 months now, believe it or not, it's crazy. And so I also was able to secure some funding through the National Institutes of Health and Dermatology Foundation. I also passed my board exams this July, and then spent a month in September. Thank you. I spent a month in September in Madrid with Dr. Alvaro Gonzalez-Cantero. And I would like to thank my family as well and my husband, because all of this would not have been possible without them. So thank you to them as well. So I have a few research interests. The first is studying the systemic effects of biologics and oral medications on cardiovascular disease and psoriasis, and I'll be talking about this tomorrow at the Gene to Clinic meeting. And then my other interest is computational pharmacology to identify the potential therapeutic functions of microbial-derived metabolites on psoriasis and its comorbidities. And so I believe we made history this year. So someone will have to fact check, but when I found out I was participating in this program, I told Dr. Kevin Cooper, our chair, and he was so excited he wanted to sponsor Dr. Gonzalez-Cantero to come to Cleveland. And so to commemorate this potentially historical event, I made this animation. Dr. Gonzalez-Cantero came to Cleveland, and we had a wonderful time brainstorming how we were going to collaborate and unite our two psoriasis cohorts together. And after a long day of talking about research and brainstorming, we went to Dr. Cooper's home and we had a lovely dinner. And so then it was time for Dr. Gonzalez-Cantero to go back to Madrid. And then it was my turn shortly after. And so I had to include Vera because she's been my co-pilot throughout all of this. And she handled the time zone changes like a champ, like a seasoned traveler. So while I was in Madrid, I spent time at 3 different sites. The first was the Hospital Ramon y Cajal, which is the public hospital where Dr. Gonzalez-Cantero has developed his psoriasis cohort of about 120 patients, where he's done extensive cardiovascular imaging at baseline and 1 year after biologic therapy. And then I also spent time at the International Center for Medical Research, which he established just a few short years ago. It is already one of the largest dermatology clinical trial centers in Spain. So it was interesting to see how he has set that up. And then I also spent time at the Grupo Pedro Juan, where it's a private practice where he specializes in providing biologics at the private level. And so I learned a lot during my 4 weeks there. Dr. Gonzalez-Cantero has done a wonderful job with setting up his research team. He does an excellent job motivating them. I also got to see how he collaborates with pharmaceutical companies and other universities, and he's done a lot for strategic planning and setting his research goals, has also done a very great job with organizing his biorepository. So as I'm starting my early career, that was great to see how he's established himself so expertly early on to set himself up for success. And so here's a few pictures of us exploring Madrid. That's my husband, and then Vera, of course, and she had a wonderful time, and that was her first time on the subway, which she had a lot of fun with. And so my future goals are to be at an academic practice. I want to focus on research in psoriasis and do clinical translational focused research and secure funding, hopefully, to continue with that, and also have a psoriasis subspecialty clinic. And so here's me with Dr. Kevin Cooper and Dr. Gonzalez-Cantero when he visited in Cleveland. Thanks again to the IPC for bringing us all together.
That was really fantastic. You know, hearing all the fellows' talks really reminds me of how closely aligned this program is with our mission, which is to improve the health and well-being of people with psoriasis and associated diseases worldwide through education, research, and advocacy. So congratulations to all the fellows. A round of applause for all of them, please.